family, hi everyone, and welcome back to my YouTube channel. My name is Cynthia, and on my channel I talk about nursing, more especially overseas nurses that would like to work in the UK. I do a bit of lifestyle and vlogging and all of that good stuff. Today's video is going to be about the second part of a previous video I did before, which was trying to compare care home nursing job and NHS nursing job in the UK. So if you've not watched the first one, I'll leave a link up here on the screen so you can click on it and watch the video. So I'll be diving into the first point, interprofessional relationship and interprofessional workforce. So in a hospital in the UK, example in my ward, we have the speech and language therapist. So this is a professional who specializes on assessing the patients and knowing if they can swallow and what they can swallow. Like, they basically look at what the patients can do in terms of swallowing, in terms of eating and drinking. So apart from this, we also have the dietitian, physiotherapist. These sets of people assess the patient's mobility. They give the patient, if the patient would need a stick, if the patient would need a Zimmer frame, if the patient would need extra support device to walk. It is the work of the physiotherapist to do this. Occupational therapists, we have the pharmacists, we have the nurses, which obviously I'm one of them. Doctors who finalizes the decisions in each of these things I mentioned. In the hospital, you can see a lot of professionalism. You can see lots of people in a day. But this is quite different when it comes to the care home, because in a care home you don't have lots of all these professionals I mentioned before. So it is quite different. If you are the type that would like to associate with different sorts of professionals, you would like to meet different people in a day at work, you would like to associate, I think working in the NHS hospital would be the best option for you. In addition to nurses, we also have the student nurses, we also have the nursing associate trainees, we also have student doctors. In a day, you might be expected to teach a particular student nurse. You might have a student nurse who will be working under you, so you have to also develop your teaching skills, because you have to teach them. When it comes to workload, I just think it depends on the ward you are working in. For example, I work in the stroke ward and we have average of 4 to 6 patients per nurse, whereas someone that works in the care home could have up to 40 patients in a shift to look after. However, this depends on if you as a nurse is expected to maybe do something like observations, do something like the blood sugar monitoring in the hospital. So some wards the care support worker do it, some wards it's just the nurses that are allowed to do it. Now this is a very serious one because I got some questions about this from my last video. So if you are thinking about changing an employer, if you don't like working in a particular place for a long period of time, I think working in NHS will be the best option for you, because in NHS you can change your employer, depends on your contract as well. But then most of the NHS hospitals you can change from one hospital to the other. Say you are living, say for example you are living in the east and now you want to move to the west or something of that nature, you can always change your employer if you are employed by the NHS after maybe 1 year averagely. But then if you are working in a care home, you do not have this opportunity to do this. You can not really change employers that quick. So also make sure you look at your contract before you sign. Make sure you read it properly. I always emphasize on this most of my videos, so make sure you read whatever you want to sign before you sign it. Now another point is miscellaneous benefits. So when it comes to these benefits, if you are working in the NHS hospital, you get discounts for most of the things you buy. You get discounts even in shops, even when you go for your grocery shopping, even when you go for your fashion shopping, when you go to buy your dresses, your outfits and all of that. So some of these shops do NHS discounts, but you have to make sure you go with your NHS card anytime you want to shop or anytime you're going around the city, because you might have a discount on that day, and if you do not have your card or any sort of identification, you might not be given this discount. Secondly, when it comes to technology, so say things like phones, things like laptops, things like cameras may have a discount for NHS nurses. So for example, the camera I'm using to film this video, I was given a discount for it because I'm working in the NHS hospital. When you are using buses or trains for your transports, and maybe you're going to work with buses every day, you also get a discount for working in the NHS. So for me, when I was using the bus to go to work, I had like 30 pounds off the payment that I should be doing for using the bus in a month. So instead of paying a certain amount of money, I had to pay like half of it to use the bus to work. Now I recently registered to do my driving school, to do my driving practical exam, and I was so surprised that my driving instructor was doing NHS discount. So even when you want to drive, when you're about to learn how to drive and all of that, in the UK this is very expensive. It's quite expensive, and you will need some form of discount when it comes to things like this. Now I will be moving over to talk about pay, the money. So when it comes to payment, when it comes to remuneration, you can't compare care home to the hospital. So the care home setting pays very well. They pay more than the hospital. So if you like to get more payment, if you like to get more money, I'll advise you go to the care home setting. So as a nurse in care home, the salary in a care home can be more than that of a nurse in the NHS hospital by, say, an average of 3 to 6 pounds. So when it comes to care home versus hospital pay, a nurse in a care home can have an average of 3 to 6 pounds more pay than the nurse in the hospital. So let's say a nurse in the hospital is getting like 12 pounds per hour. A nurse in a care home can get up to 15, 16, 17, 18 pounds per hour averagely. So it might be more, it might be less, but this is the average estimation of what it can be. Now if you're working in a care home and you are sick, you can get paid about 80 to 100 pounds per week, but someone that works in the hospital can get paid 100% of your salary depending on how long you've been on your sick leave. And if you've been for a very long time, you can get paid up to 80% of your salary in every month. If you're pregnant in a care home and you're pregnant and you had a baby in a care home, and you were pregnant and you had a baby in a hospital setting, the pay is not the same. The hospital pays you more. Okay, so all this comes into consideration when you want to choose where to work. For people that want to get that money, that want to be paid very well, more than every other nurse, you can go to the home care setting. It is the best for you. However, if you are looking at the long-term benefits, or you're looking at maybe your phone benefits, your travel expenses, your discounts, your sick pay, your maternity pay, sick pay, and all of that pay being more, you have to go to the hospital because that will be the best for you. So it depends on what you want. Everyone has its own advantage and disadvantage, so you have to make an informed decision. You have to make sure you know what you're choosing for yourself, and there is no better place to work. There are always challenges everywhere. So for me, there is no definite place for someone to work and get that full benefit, get that full pay, get that full everything. So each one has its own cons and pros. Choose wisely where you want to work and be sure to enjoy it. Another thing is, try not to compare all the time because you can't get everything. So this will be the end of this video, and if you feel you still have more questions about working in the care home and working in the hospital setting, the differences and all of that, you can always comment and ask me the question you want, and I will be sure to answer you. Please do not forget to like this video, do not forget to comment, and do not forget to subscribe here on the subscribe button. Put the notification bell on so you get to know first when I post more videos. See you next time, and bye bye.